Hello, welcome to my channel. My name is Bridget. I'm a nurse practitioner. In today's video, we will be going over 5 NCLEX style questions for mental health, courtesy of nursing.com. Before we get started, I just want to let you know that nursing.com, between August 16th through 24, they are offering a huge back to school promo. And so between August 16th and August 24, nursing.com is offering 40% off their 2-year plan. And in addition, anyone that starts a 2-year membership, they will be shipped a book bundle that is a total saving of about $300. And the books include 140 must-know meds, 63 must-know lab values, nursing mnemonics, and the second edition NCLEX review book. Which the following describes a purpose of the psychosocial assessment. So the psychosocial assessment includes asking about a person's family history, their general health, well-being questions, and asking about any past traumatic experiences. So the best answer is to understand a client's current issues. A nurse may perform a psychosocial assessment to evaluate the client's mental health status and determine whether the client is at risk of medical, emotional, or social health problems. To prevent the client from hurting themselves, this is a suicide assessment. When I used to work in psych, we called it a lethality assessment. So out of all of them, this is the best choice. This question was considered easy, 69% answered correctly. A client is becoming violent toward the staff. The nurse considers behavioral health restraints and seclusion to protect the client and staff. Which principles must the nurse consider before implementing this type of restraint? Select all that apply. So keep in mind always on the NCLEX that you make sure that you read when it is a select all that apply. Believe it or not, sometimes students will not read that it's a select all that apply and they only select one answer, just kind of, they're rushing. So behavioral restraints are less painful compared to medical restraints. That is not true. Restraints shouldn't be painful, period, but one isn't less compared to another, so not selecting that. The client will need to have constant one-on-one monitoring. Very true. Because think about it, if someone is restrained and they vomit and then they're not being watched, they could aspirate, they could choke on their own vomit. The provider must see the client and order the behavioral health restraints. And behavioral restraints should be used early option for behavioral control. That's grammatically incorrect, but it also is incorrect, period. And an orthopedic appliance can be a behavioral. So it just helps that I worked in psych. This question was hard. 27% answered this correctly. By law, the provider must see the client and order the behavioral health restraints. Keep in mind that nurses can initiate restraints, but the order does need to come within the hour. And let's see here. The rules for implementing behavioral restraints are very restrictive. They need one-on-one monitoring. And actually, the nurse signs off on the patient. So the tech is signing off every 15 minutes and the nurse is signing off every hour. So that is a little bit of a discrepancy here. The client will need to have constant one-on-one monitoring, again, from what I said before, just to make sure that the patient is safe. If you have any questions about restraints, drop a comment below. Also, drop a comment below if you would like me to do NCLEX questions on any other topic like cardiac or fundamentals, anything like that. A nurse is caring for a client with post-traumatic stress disorder who has been suffering from insomnia. Which of the following directions could the nurse give that would most likely be related to sleep hygiene for this client? So sleep hygiene just refers to doing things that are conducive to sleep. So for example, if you're worried about something, writing it down, no electronics, let's say like an hour before bed or even 2 hours before bed, not exercising up to like 3 hours before bed. Those are all sleep hygiene, good sleep hygiene practices. Try to go to bed and get up at the same time every day. That sounds good, but I'm going to read the rest of them. Get regular exercise, preferably within an hour of going to bed at night. Nope. Now, this one is a distractor because if you are one of those people that are like, jumped the gun, essentially, if you're one of those people that jump the gun, essentially, and you see get regular exercise, you're like, oh, that sounds right. But if you don't read the rest of it, you're going to get it wrong. Eat a meal that contains plenty of carbohydrates before going to bed. no, not true. And actually, they show that like people that eat a heavy meal, they don't sleep as well, and they also tend to have a lot of nightmares. Lie in bed for a while doing a quiet activity such as reading a book before trying to sleep. Reading a book is a good option, but lying in bed while doing it, they say don't go to your bed until you're ready to go to bed. So that's the only reason. Again, I've just done this for so many years that I know like not to pick that one. This was a medium question. 64% answered this correctly. Beds should be reserved for sleeping and SEX only. I just don't want to get flagged by YouTube. Other activities should be done in a different location. And the reason for that is because you want your brain to associate the bed with sleep. Sleep hygiene is an important component of managing sleep disorders. The client should be taught to use the bed only for sleeping and SEX, to eat a healthy diet, exercise regularly, but not at bedtime, and to avoid caffeine late in the day. The client should also be taught to go to bed and get up at the same time each day. A client who has been struggling with an addiction to, you know what this says here, has been receiving treatment at an inpatient facility for the past month and is almost ready to be discharged home. Which of the following should be considered as part of appropriate discharge care for this client? A meeting with family members to help them structure the client's environment. Oh, and the reason why I'm not reading certain words is because if YouTube flags it, then the video cannot be monetized. So that's why. Addiction, right? That's the first thing that jumps out at me. A meeting with family members to help them structure the client's environment. An appointment for an individual or group therapy session. A prescription for that the client can take on his own. A plan for monitoring the client's activities once discharged. So the reason why I picked this one is because we want to help patients be independent. And sometimes people have very dysfunctional family members, or they don't even have family. So that isn't the best option. And a client who has gone through rehabilitation for treatment of substance abuse needs ongoing support after discharge from an inpatient facility, because relapses can occur and recovery from substance abuse is extremely challenging. Once discharged, the client who has abused drugs is usually given a measure of independence. Monitoring the client's activities and requiring the family to structure the client's life after discharge are not helpful activities to promote client independence. This was a medium question. 55 answered this correctly. A client who is in the hospital has asked the nurse to find a spiritual advisor who can meet with the client while hospitalized. Which of the following describes the role of the chaplain in the hospital? Select all that apply. So the chaplain is there for spiritual support. A person's individual description of self, that doesn't really qualify. Guidance to clients and families regarding things of a religious nature, and definitely prayer. It is not the responsibility of the chaplain for emotional stability. That's not in their job description, or to discuss their description of self. And you can pause to read here. Thank you so much for watching. Make sure you join the challenge. I'm trying to hit 30,000 subscribers by the end of September. So please like, subscribe, turn on the notification bell. It helps other students like yourself tremendously.